What's up, coaches and clinicians? I'm going to show you today one of my favorite exercises, and the cue for it, the easiest one for the rotational squat, is called the chop. We typically do this for knee, hip, and foot conditions. Enjoy. The rotational squat's one of my favorite exercises for loading the hip, so we spare other parts of the body surrounding it. I like to use a sticker just as guidance. We should be able to take the spine and drill it down screw it into the ground every single time into the sticker. We shouldn't deviate left or right. Now, to load the hip, I like to think hand in the holster, but a lot of times people lose their ground contact. So the 3 points of contact on both feet, whether you're going to it or not, should be drilled into the ground, just absolutely stuck there. Now, the hand going to the holster, sometimes people think of it as like chopping. So we chop the hip back, keep the chest and the pelvis in the same alignment. They shouldn't be going different directions. Chop the other way. Notice my knee is deviating out. Now when we chop, this knee should still be in that same vector. This way is bad. Look at the foot. It loses ground contact. Clinicians and coaches, try this with some of your athletes or your patients today that are experiencing knee, foot, ankle, hip, and back pain. You'd be surprised.